A recent study has raised serious concerns about the growing influence of social media on the promotion of medical tests, especially those targeting generally healthy individuals. The study, led by the University of Sydney, found that influencers across platforms like Instagram and TikTok are using fear-mongering tactics to promote health tests with limited evidence supporting their effectiveness. This trend is not only misleading, but it also carries significant risks, including the overdiagnosis of healthy individuals and the psychological and financial burdens associated with unnecessary testing. The study focused on 5 medical tests that are being widely promoted on social media despite a lack of strong scientific backing. These tests include full-body MRI scans, genetic testing for early cancer detection, testosterone level tests, egg count tests, also known as the anti-Müllerian hormone or egg timer test, and gut microbiome tests. Researchers identified nearly 1,000 social media posts related to these tests, and the results were alarming. The overwhelming majority of posts highlighted the purported benefits of these tests, with little to no mention of their potential harms, such as overdiagnosis, unnecessary treatments, or emotional distress. One of the most concerning aspects of this trend is the way influencers and other promoters frame these tests as empowering individuals to take control of their health. However, this narrative fails to address the very real risks that come with overdiagnosis, a phenomenon where medical tests identify diseases that may never cause harm. For example, full-body MRIs and multi-cancer early detection tests, often marketed as a way to catch cancer early, can lead to the identification of tumors that are so small and slow-growing they would never have caused any symptoms or posed a health risk. In these cases, the knowledge of having cancer can result in unnecessary anxiety, costly treatments, and invasive procedures, including surgeries that may not have been needed. Moreover, many of these tests come with hefty price tags. Full-body MRIs, for instance, can cost upwards of $800 in countries like Australia, and these costs can be just the beginning. If an individual's test results lead to further procedures or treatments, the financial burden increases. The marketing of these tests often ignores the fact that many people are encouraged to undergo expensive and potentially harmful interventions based on results that may have no meaningful impact on their long-term health. In the case of the egg count tests, which are often promoted to younger women, there are significant risks of unnecessary anxiety. These tests, which claim to measure a woman's fertility, cannot reliably predict her ability to conceive. As a result, women with low results may feel pressured to pursue costly and invasive fertility treatments like egg freezing or in vitro fertilization, IVF, even though these steps may not be necessary. The promotion of these tests often preys on the insecurities of young women who may be years away from making decisions about starting a family, exacerbating fears that time is running out for their fertility. The testosterone tests, meanwhile, are typically marketed with a focus on masculinity, often emphasizing signs of low testosterone like the inability to wake up with a boner. These tests, which are frequently accompanied by narratives about masculinity and the need to fix perceived problems, carry the potential for harm, particularly when men are encouraged to take testosterone supplements or undergo hormone treatments. There is little long-term evidence regarding the safety and efficacy of such treatments, and they may lead to side effects or other health complications that are not fully understood. Perhaps the most troubling aspect of this trend is the way in which these tests are often sold directly to consumers, bypassing medical professionals entirely. This removes an essential safeguard, the doctor-patient conversation, during which a healthcare provider can assess whether a test is truly necessary based on a patient's health history, symptoms, and risk factors. Instead, consumers are left to make decisions based on emotionally charged social media posts and the persuasive tactics of influencers, many of whom have financial stakes in the sale of these tests. The study's lead author, Dr. Brooke Nickel, and other experts involved in the research are calling for stronger regulation of medical advertising on social media. They argue that the current environment leaves too much room for misinformation and that individuals should not have to be experts in medical science to navigate the deluge of health-related content they encounter online. In light of these concerns, Dr. Nickel emphasized the need for clearer guidelines around the promotion of health tests, as well as better public education on the potential risks of overdiagnosis and unnecessary treatments. Professor Stacy Carter, an expert in health engagement at the University of Wollongong, echoed these concerns, pointing out that this study adds to the growing body of evidence showing that medical misinformation is rampant on social media. He warned that individuals who rely on influencers for health advice may be making decisions based on incomplete or misleading information, which can have serious consequences for their physical and mental well-being. In conclusion, while the rise of social media influencers has democratized access to health information, it has also created a space where misinformation can spread unchecked. As this study makes clear, the promotion of medical tests without sufficient scientific backing or consideration of their potential harms is not only misleading, but can be actively dangerous. Until stronger regulations are put in place, individuals must be cautious about the health advice they receive on social media and, whenever possible, seek guidance from trusted medical professionals before making decisions about testing or treatment.